You're listening to the Turn Autism Around podcast, episode number 146. Today, I had a great conversation with Tameika Meadows, who is a board certified behavior analyst who resides in Atlanta, Georgia. She has nearly 2 decades of experience providing ABA in schools, homes, clinics, and she is the creator author of a blog called iloveaba.com, which is accessed daily by thousands of people all over the world, including myself. And I started looking at that blog about a decade ago. So today we talk about good ABA versus bad ABA, how to spot really quality programs, is home or school ABA better, and a host of other issues, but that's the gist of it. It was a great conversation. Hope you love it as much as I did. Let's get to this special interview with Tameika Meadows. So Tameika, it is so great to meet you and have you on the show. Thanks so much for joining us today.
Thank you. I'm happy to be here.
So this is my first interview where the interviewee is in a car, and you said
yes.
You don't have great internet connection in your house. So you actually went somewhere and you're in your car. You look great.
Thank you.
So anyway, we like to start the same way. And I don't know the answer to this story at all, but describe your fall into the autism world.
Sure. Well, I had a bit of a accidental entry. Like some, I was a college student on campus. I saw a flyer that I assumed was for babysitting. And so I responded. I went out, I met the mom and her child, and got a very kind of quick synopsis of what they were doing, this therapy, autism, because at the time I did not know what that was. I did not know what ABA was. I never heard of it. And she showed me a few video clips of him during session. And I was just like, what is this? And how do I be a part of this? Because this is way more interesting than what I'm learning in class. And that was pretty much my thought going in. And I started working with that one family, and then started seeing other families, started getting recommendations. And then it reached a point where I had a specific consultant who was working with us say to me, you know, you really should look into this as like a career. Like, I think you'd like it. I think you take to it very well. And I was like, wait, this is like a career? And she sent me to the BCBA website, and that was it. I looked into the process for getting certified, went to grad school, and here we are. So
wow.
I very much fell in.
Yeah. And that is a very common pattern for parents. It's their child was diagnosed. For professionals like yourself, it is a lot of times answering an ad in high school or college and getting hooked by working with one child.
And just loving it and saying, I want to do this all the time. How do I make that happen? Yeah.
So I'm excited because you're a behavior analyst, as I am, and you have a blog called iloveaba.com, which is, I've been following it for years. What year did you create that?
Oh gosh, I want to say 2011, but don't hold me to that, but that sounds right.
Yeah. So it is pretty visited a lot. It has a lot of traffic to that iloveaba.com site. So today we're going to talk about good ABA, bad ABA.
Yes.
Versus school ABA.
Yes.
Answering questions that I get all the time. Why do some people hate ABA? Is ABA abuse? I mean, just the whole gamut that, unfortunately, even if you are a listener out there, and we think we have about 70% parents out there listening and about 30% professionals. But even if you're a parent with a child with a new diagnosis, unfortunately, you've probably heard there is controversy around
100%. I mean, it would be hard not to, I would say. To have never heard anything negative, I think would be kind of hard.
Right, right. So why is that, Tameika? Why is there controversy and people that think ABA is abuse?
I really think that it's a very diverse group of people who tend to be against ABA, tend to speak out very loudly online, on Twitter, on Facebook, wherever. I do not think there is a kind of unified reason for it. I see a lot of different reasons. I see a lot of different perspectives. Sometimes these are people who received services and those services were awful. Those services had no respect of the dignity of the individual. Sometimes it's people who, for them, their autism is not disabling. It is not something they view as a disorder. So they don't understand why there's an entire industry built on giving therapy to young children. They don't get it. They think it's wrong. There's a lot of different reasons and viewpoints. You even have people in the field, like myself, who really want to see ABA step forward and grow and advance and get better. And, we want to see our ethics get better, and we want to see the way we do things change and evolve. So it's a diverse issue. It's a weighty issue. There's a lot of feelings involved. People are very emotionally invested. And I can't imagine, as a parent, trying to navigate all of that to make a decision for your child. It must be so confusing and scary of just, okay, but what do we do? Because there's all these different voices, but they're all just as passionate. So what do we do? I can't imagine how hard that is.
Right. Because ABA, applied behavior analysis, was back when my son Lucas was diagnosed 2 decades ago, was and still is the most evidence-based treatment for children with autism.
Correct.
And it is all 50 states are required to provide insurance coverage, and then you get, if autism is a gift and it's not a disorder, why are we treating?
Why are we treating it? Why does it need treatment?
And so it is really hard for parents, I'm sure, to wade through the controversy. I mean, they just want to help their child.
Right.
And when they get all of that overload, which Lucas was diagnosed, it was 1999. There was no Facebook. There was barely.
Correct.
So I didn't know back then, when I started ABA, that there was any controversy. I had no idea. And even when I started in the online world, it wasn't as loud.
Agreed. Yeah. Same.
And now it's
very different.
It's
very different.
Getting louder. And really what I'm trying to do, and I think, I don't know you well, but I know your work on I Love ABA. And what we're trying to do is help each child reach his or her fullest potential.
Right.
And whether that includes going on to still have moderate to severe autism and have, problems communicating and having, that's fine, but we're going to work to see if we can help the child catch up in terms of language and self-care,
improvement,
and really,
for quality of life.
And the earlier you start that, the better. Like, it was just an article that came out just this week, which said that one study is showing that parent-led therapy, as soon as you have a child with delays, parent-led therapy is showing real improvements. And then I just heard somebody on the severe autism group say, oh, now we're back to blaming the mothers for not engaging the child.
Yeah, back to the 50s. Yeah, which is not, I think there's a lot of, I don't want to say confusion, but misunderstanding. There's a lot of misunderstanding about what the intent and goal and purpose of intervention should be. I agree with anyone who is saying the focus should not be to remove autism. Agreed. I agree with you. That should not be the focus, but everyone's autism is different. We can all agree with that. It is not a monolith. So one person's experience of autism does not mean you get to now speak for every single person's experience of autism. And so for other people who don't have a consistent means of communication, they don't have the ability to use a bathroom by themselves, which is like a human right to not need people in the bathroom with you. For people who are not having an experience like you, can you at least see that they could use some help, some supports, some resources? Their family probably could use some help. Their teachers probably could use some help. That should be the goal of intervention, is to come in and to say, okay, where do we need help? Where do we need more support? Where is this individual getting so frustrated and so angry because they don't have a way to let people know what they want and what they need? Not to come in and say, let's make you quote unquote normal. That should not be the goal. And I agree with anyone who says that. But unfortunately, I think that's where the conversation stops. And I would love to see the conversation continue so we can really start talking to each other about how do we make this better for everyone participating in this treatment, instead of just kind of attacking it. Let's talk about, okay, what do we need to improve? What do we need to do different? How do we listen to autistic voices? Like, let's engage instead of like battling. I just feel like battling doesn't really help anybody.
No, it doesn't. And I talk in my new book, Turn Autism Around, about Dr. Ami Klin's research and his work. And I went to see him a few times, and I actually did a solo show on the work of Ami Klin. And I was at a lecture, I think in 2019 with him, and I asked a question. I'm like, do you think you can prevent autism? And he said, no, based on his work, he does not believe you can prevent autism. But he said, based on his research, he is really certain that you can prevent and reverse speech delays and disorders, behavioral disorders, and intellectual disability that will often come with severe autism if it's not treated early enough and intensively enough. And so that's really the goal. I mean, my son, Lucas, is 25. He has moderate to severe autism, intellectual disability, speech disorder, and behavioral disorder. And I did very intensive ABA starting at the age of 3.25. Had I started it earlier at 21 months when my husband first mentioned it, would his life be different? I do believe it would. Nobody has a crystal ball to look backwards.
Right. None of us know.
That's not ruining my life. And
right.
It's not, it's not a problem. But when people say ABA is abuse,
right,
I'm sorry, but I do not agree. I'm not even sorry. I don't agree. And you have a website that's iloveaba.com. So obviously you don't agree either, but there is good ABA and bad ABA.
100%.
So how do parents and professionals, this is also a problem for therapists, new BCBAs.
Yes, it is.
They get trapped in these jobs that are doing quote unquote bad ABA that
100%.
I would think is bad ABA. So what's the difference? How can you tell?
I think let's start with parents. So for any parent or caregiver, if you are trying to determine a quality place for your child to receive services, you really have to start by looking at what's the goal of intervention. I really feel like that's like the foundational first step, because if you are speaking with a company or a provider and they're talking about, we're going to fix this, we're going to correct blank, we're going to make your child more, we're going to, remove stigma, like words like that, all of those words are getting at normalizing. All of those words, which again, should not be the goal. The goal should not be we're going to magically make it as if you were born differently. The goal should be We're going to give you as many supports as you need so that you can contact the things you need to contact in life. You can let people know when you want food. You can go out and use a bathroom. You can attend school, because in certain parts of the world with an autism diagnosis, you can't even go to school. So we really have to kind of look at what this means for that individual and how it's kind of making barriers to being able to do different things in their life. And then we address each barrier one by one. That should be the goal. We're going to help your child do blank. We're going to make it easier for your child to do blank. That should be the kind of language that is being said by a provider, by a company. And I can definitely say I know of companies and providers in my area where that is not the language where that parents are hearing, and that should be a red flag. It should be very, very concerning when you are contacting a provider saying we need help, and that provider is instead telling you, here's what we're going to do. And they're not listening to you, and they're not taking your input, and they're just saying, oh, yeah, we know what to do. We know autistic kids. Here's the protocol. Here's the strategy. No, that is not how that should work. Absolutely not.
Okay, so language is one thing when you're interviewing companies.
Absolutely.
But people can talk the talk, but not do the right thing either. So if you are observing a classroom, and with COVID, sometimes you can't even observe classrooms now. But say the world is opened up and you can observe the classroom or speak to the teacher. What kinds of things would you recommend looking for? I know I actually have a couple things we're going to link in the show notes. I have a Myths and Truths about ABA podcast, and I also have a is school versus home ABA,
which one's better,
and that sort of thing. So I have those two resources. We'll link them in the show notes. But say you are going to evaluate, we can talk about the differences between clinic and home and school. But say you are going into a clinic or a school to interview, to look around, what kind of things would you look to see that it would indicate better therapy?
Well, there are some settings that don't even allow parents to do that. So I feel like we need to start there. If you can't even go in and take a look, that's a problem.
Well, and now some people are blaming it on COVID.
Oh, I mean, prior to COVID.
Yeah, right. But prior to
center
COVID,
policy that you can't go in.
Yeah, because it violates other kids' rights to their.
Yeah, they'll come up with all kinds of reasons. But it's just, how can you evaluate something if you never see it? Is kind of where my mind goes.
And it would really be heartbreaking to send my child on a special needs bus to.
Can you imagine? And you've never been in the doors? I just. Yeah, so that should be a big waving red flag. But let's assume it's a place that lets you come in. So you should be looking for the strategies, the goals, and the reinforcement that you already agreed to as part of your child's treatment. It should not be a surprise when you go to observe and you say, I don't remember that we said we were going to work on eye contact, or I think I already told you I don't want you using edible reinforcers. There shouldn't be little surprise moments like that, because every part of the intervention should have that caregiver involvement and caregiver consent. So if you don't know what your child is working on at the center, in the classroom, at the facility, they're using strategies or techniques that you feel uncomfortable with, you didn't agree to, you don't feel like they are right for your child, and you've said that and they're using them anyway, these are all red flags that you are not dealing with a quality setting, a quality provider. If you are having issues talking to the person who is designing the treatment, whether that's the BCBA, the program supervisor, but you're not being heard, your considerations are not being taken. If you say, I don't want you using this strategy with my child, they're using it anyway. That's a problem. These are things that parents absolutely can see and recognize, even if they're saying something different, with your own eyes, you can see that it's not the case. You can see that it's not happening and that you're not being heard.
And I think a lot of parents, when they're just trying to evaluate a setting, they don't know what they're supposed to do. So they really want to trust the professionals to just do the right thing. And I mean, that's okay, as long as my ideas about like going in to see a placement. I don't care if you're talking about a regular daycare for a typical toddler, or whether you're talking about a special needs classroom, or whatever you're evaluating. My first thing is, I want to see positivity. I want to see happy children. I don't want to see, I mean, kids can tantrum and stuff, but if
they will, if that's their communication system. Yeah.
During the tour, if you've got kids on the floor, or screaming, or you have not even kids unhappy, you have negativity among
staff.
Provider, stop that. I'm going to put the jump rope away if you don't share. I told you 5 times, get in line, stand with your, negative.
Yep.
I don't want my child in a negative environment. So that's number one for me. And then I also want, like in my online courses and my book, I want the parent to be the captain of the ship.
They should be. Yeah.
Maybe they don't start there, but after they, we've had a number of instances. Kelsey from podcast 3, we can link that in the show notes. She knew she needed ABA. She had a friend who was a BCBA. She's driving her child, 2.5-year-old, an hour away. A BCBA is working on colors when he's banging his head on hard surfaces 100 times a day, eloping from the clinic down the street.
Wow.
And doesn't have the ability to request things.
Yeah.
Takes my online course. She's like, hello, I don't think you should be working on colors.
Right.
We said, you know what? We don't need your input. And if he comes back, he's going to need to wear a helmet to protect his head. It's like, why should a 2.5-year-old be banging his head?
Right.
Right. Kind of got kicked out all at the same time. And worked with him at home on her own with just my online stuff. Like it's just, and this isn't like, I don't know where this place is. And I'm not saying that BCBA, I mean, we would both agree that was an example of bad ABA.
Yes.
That person's bad. It's just the training and the lack of, if that were me, whatever I was doing, even if I thought it was the best therapy I could provide as a seasoned behavior analyst, and if somebody came in and said, I've just been watching these other videos and I'm more comfortable with this, can we talk about it? I'd be like, especially if the child wasn't doing well. Right. I'm doing this at home with him and he's talking and he's requesting, can we talk about it? I mean, that should just be, automatic. If somebody says they're doing something working,
it definitely should.
Let's open our mind. It doesn't have to be ABA.
And take the input of that caregiver, who is the person who knows that individual child the best. It's not me.
Right.
It's that caregiver. So if you are dealing with someone who won't even listen to what you're saying about your own child, that's a problem.
Yeah.
That's a problem.
Yeah.
I don't care what kind of credential they have. That's a problem.
Right. So I think, it also gives ABA, continues to give ABA a bad name in many schools.
Yes.
So what are your thoughts on home versus a clinic ABA setting, especially for a newly diagnosed toddler?
I very much think that it is individualized. I don't think that there is one that is automatically better than the other, because it depends on what that individual child is working on, what their needs are. It depends on the commitment ability of the family.
Yes.
Because when you're talking about center-based, most of them, it's going to be intensive. So your child's going to be there all day, every day. How exactly are you going to learn what they're doing if you are at work all day and the child is at the center all day? You're not. And so essentially, they're going to a place and learning skills and gaining all these abilities, and then they're coming home. And what I hear over and over again is, oh, we tried XYZ Center, but nothing changed at home. Everything at home was the same. The reason why that happens is there has to be intentional generalization from one environment to the other. And most of your kind of everyday working families, they don't have the availability to do that. And so in that case, I would say you probably need to start off with home-based. So you can at least learn this and learn what it is and learn how to do it at home. And then you can send them to a facility where now, okay, now I know what you're doing during the day because I've been taught how to do these strategies myself. So it's very, very individualized. And I don't like to see families kind of shuttled into one or the other automatically. I don't think that's a good thing because there's pros and cons to both. And you kind of have to decide, like, what are your priorities? What's most important to you? And I can't make that decision for you. That's a family decision.
Yeah. Yeah. And I think the other problem, and we have people from all over the world who are
Oh,
listening,
great.
is, lack of access to
Yes.
anything, like
To
not
anything.
even to a BCBA in a clinic.
Yeah.
And that's the problem. Like Kelsey, is driving an hour away and insurance is paying. And then you're like, it took me X amount of time to get in line, to get to the front of the line. And
Yes.
then sometimes clinics have the attitude, or even home programs. I mean, I've seen this happen at home too. It's not, just at clinics where it's like, hey, if you're going to be a problem, mom,
We have a waiting list of 200
yeah.
families. We don't have to deal with
And
this.
so you can just take your little ball and go home and take your little,
Yep.
like, I used to joke that like Lucas was cute enough. They just didn't want me at all. You can imagine me involved as the parent. It's like, what are you doing?
Right. And explain it and then show me the data of what you're doing.
But there's lack of access and
Yes.
and that's one of the reasons, the main reason why I am pursuing, why I wrote my new book, why I'm pursuing really teaching the parents, because like, as you said, they're the experts. They're also, they have the long-term
they do
game in mind. And, whatever you learn, from a behavior analyst or from the materials that are on Tameika's blog or on my website and courses, whatever you learn, you can then reapply. Like I remember
100%.
Who was featured in one of the podcasts, and Cody was a former client who gave me video permission and everything. And I remember her, like, I was still consulting with the family and she's like, yeah, this went downhill. And I was like, almost going to call you. And then I was like, no, Mary would say, you have a problem. Demands are too high.
Oh, that's
Reinforcement's
awesome.
too low. So then I increased the reinforcement and turned it around myself.
That's how that should look. That's perfect.
Yeah. Yeah. So I think that's, something we can agree on. So whether you're doing it at home or in a clinic or a school, Tameika's advice, look for the right language, look for, yes, we are going to work with you, the mom or dad or family or caregiver. We are going to coordinate with you, even if it is a clinic all day. And, there's also families with multiple kids and moms at work and dads at work. And it's like, we can't just make the rule like home is best, assuming everybody has 2.5 kids and lives in the suburbs. Right. That's just not.
Which is not the case. Not the case.
Not the case. So one of the things I get questions all the time, like, how can I find a clinic that uses the verbal behavior approach, was my first book, or lately, where can I find a clinic or provider that knows the turn autism around approach? It's like, yeah, good luck with that. But what I do recommend, and I have looked at your blogs and believe that you have expertise with like the ABLES and the BB map and intraverbals and all the things that we talk about, because there is also a difference between traditional ABA that doesn't utilize Skinner's analysis of verbal behavior.
Correct. Correct.
And me being, so involved with verbal behavior and now the turn autism around approach, there's going to be very few people who are trained and knowledgeable about the turn autism around approach. But what I recommend people do is, if you are in Tampa, Florida, just search autism, ABA, verbal behavior, even VB map, because I'm very partial to the VB map, and then Tampa, Florida, and see what comes up.
Right.
Now, I have seen clinics and schools where they use the VB map for diagnosis and for like the first evaluation, the first assessment, but then they still are working on things like eye contact and carrier phrases and things that I don't.
It's definitely still happening. Yeah.
But at least you have people with a base knowledge of, we're going to use verbal behavior. We're going to use motivation and pairing and manding, hopefully. And maybe we can, shape our behavior together to really, that's what I'm recommending, to find quality programs. And then you have to interview them, like you said, look for language, see if you can go into.
I mean, you really do. And I completely understand, because there may be parents listening that are like, okay, there's 2 places in my local area and they both have wait lists and I'm supposed to interview them. Like, I understand how this sounds.
Yeah.
But like, when you consider that it's time and energy and effort that you cannot get back, you cannot get that time back that you spent at a not so great place, working on things that didn't matter, that weren't important, that did not really help the child on a kind of global comprehensive level. Like, it's so important to get this right. It is so important to put your energy and your time and your focus into things that are really going to help your child long term. Not just kind of, oh, he learned how to label 2 more animals this week. Okay, that's great, but he still doesn't sleep at night. And I've been telling you that for 6 months. Like, he does not sleep at night. When are we going to like address that? Like, you gotta get to the important, critical things that are happening on a daily basis and causing challenges, and not just a provider who's telling you, oh, here's what I think your child needs to work on because they're 3. Oh, they're 5, they need this. Oh, they're 7, they need this. Like, it has to be a conversation.
Yeah. And a big quote I say is, no therapy is better than bad therapy.
I agree.
And at the end of my book, in the last chapter, I say that, and I say, basically, if you made it through the whole book, no therapy is better than bad therapy. But the good news is, if you made it through my whole book, you now know how to provide,
to work with your own child. Yeah.
While you look
absolutely
better. And I think we just all, and you've done a great job with your blog and your work of empowering parents to do the right thing, to look at the important things, sleep, feed, potty training. I've done blogs, podcasts on all of that. We can put all show notes. Your show notes are going to be very long with all these resources. But speaking of resources, so parents can follow you at iloveaba.com,
and there's tons and tons and tons of resources. There's a whole section of just resources. Nothing is a fee. You just download it, print it off, and use it, because I want people to understand this stuff. And I feel like when I was kind of very early newbie in this field, people really didn't understand what I did. And I feel like in 2021, I can almost say the same thing. Like, I encounter families on a regular basis who have no idea what this is, what it's supposed to be. They're just kind of handing me their child. And I don't want that. I want families to know, like, okay, I know this is what this should look like. And I know the ethical standards for your credential. And I know that I should be asking this question. That, like, that's what I want. I want to work with informed families who are going to say, you know, we're watching what you're doing and we're watching your strategy and we're reading your behavior plan because we know what to look for. I think that's amazing. I think all providers should want that. You should want accountability. If you really care about the work that you're doing, you should want the people you're serving to agree and to say yes. Tameika's a great BCBA. We're very, like, you should want that. You know, so you shouldn't be afraid or intimidated or, you know, angry because a family has questions for you. That's a good thing. They're invested, they're involved, they want to learn. I love when families ask me questions. I think it's great.
Yeah, yeah, I think it's great too. So I like to end. We will put iloveaba.com in the show notes, and you have a lot of great resources there, and people can contact
Thank you.
that website. And we'd like to end the same way. Part of my podcast goals are not to just help the kids, but to help parents and professionals be less stressed and lead happier lives. So do you have any stress reduction tips or stress management tools that you use?
I have, I guess I would say unique. I have a little bit of a unique perspective on the whole kind of professional burnout thing, which, you know, is very big in the BCBA world. And we know in general, the ABA industry has a lot of turnover, you know, a lot of kind of unhappiness, dissatisfaction. I feel like burnout requires your consent is how I feel about that. And I think when you set boundaries and when you communicate what you need, I don't think you end up in situations where you need to have a daily self-care routine to make it through the week. And I've had positions before where I did need to do that, and all the bubble bath and scented candles in the world is not going to replace the need to work somewhere where you are respected and your boundaries aren't trampled on. So I feel like we need to do a better job of advocating for ourselves. We teach our clients to advocate, but sometimes we forget, oh, I also need to advocate, and I need to say, this is the amount of break I need. This is the amount of time off I need. After X amount of time, don't call me. Don't email me. I'm not responding. I don't work on the weekends. That's for my family. Like, we need to do a better job of setting our own boundaries to have a personal life and not trying to be everything to everyone at all times, because that's not possible. And you're just going to burn yourself out is what's going to happen.
I like that. Burnout needs your consent. Awesome. Well, thank you so much. It's been a pleasure to get to know you a little bit better today.
This was fun.
Look forward to connecting in the future, maybe in person sometime. You've just been a real bright light to our field, and I wish you all the best going forward.
Thank you. I wish you the best too. Thank you.